Hello everyone, welcome to 45 years residency training and beyond. I'm Dr. Viswanath Aluru, attending physician in physical medicine and rehabilitation at Oxnard Health in New Orleans. In this video, we will discuss about residency evaluation. So, once you're matched into a residency program, either it's a 1 year program for internship or a 3 year categorical or 4 year categorical, even 5 to 7 year categoricals. That means you already entered into an agreement with the program that you're going to stay for the entirety of the program. But you have to keep in mind that the contract you're going to sign will renew every year. So that means your contract is only good for 1 year, and at the end of the first year, the renewal will depend on your performance for that year and at the discretion of the residency committee, your program director. So how this residency evaluation works? So in the last video I mentioned about several important qualities or qualifications you need to have to be a good resident, to be able to successfully complete your residency training program. Those qualities including dependency, effective communication skills, team management skills, organizational skills. So all these qualifications, they're not only helpful for your residency training and graduation, they're also helpful beyond your residency training, whether you go into a full-time physician job, for a big organization, or you go into a private practice, or you go into a group practice. So wherever you go, these qualifications or qualities will help you to make you stand apart from other people, and they will also help you in your personal life and your career. So take these qualities with you, practice those qualities every single day. Having said that, once you are matched into your program, yes, you have a graded autonomy, but you will still be under supervision of your immediate seniors, your senior residents, your chief residents, your attending physicians, and your program director. So there's a saying, you can hide but you can't run. I don't know if I'm saying it right, but the bottom line is you will be evaluated 360 degrees by your co-residents, senior resident, chief resident, your attendings, your program director, and your staff. So you will have evaluations from time to time. You will meet one-on-one with your program director to go over some of the core competencies of the residency training. So what are those core competencies? Is mainly the patient care. Number two is medical knowledge. Number three is practice-based learning. Number four is communication. Five is professionalism. And number six is systems-based learning. So these are the six core competencies on which you will be evaluated almost every 3 months by your program director, and at the end of your first year or every year, so they will go over these evaluations. And also there will be like a in-service exam that you have to take at the end of every year. So they will take into consideration all these things and then decide, okay, so now you're eligible for a promotion. Because at the end of the residency training, then the program director has to submit all your evaluations, all your in-service exam reports to the ACGME, saying that you have successfully fulfilled all the requirements for the graduate residency training. So that's why it's important that you keep in mind all these core competencies, always follow those qualities, good principles, to be able to graduate on time from the residency program. When we talk about these core competencies, coming to the first one is the patient care. You should be able to thoroughly take a good history from your patient, including history of present illness, present medical history, surgical history, allergies, medications, family history. And when it comes to the rehab field, we talk a lot about functional history, social history. So what was the level of function before the time of admission, what kind of social support systems the patient has, and vocational history, whether the patient was working, what was the patient doing, any social habits, all those things. And Once you have a thorough history, you should be able to thoroughly evaluate the patient doing a thorough physical in order to document all the impairments thoroughly. Once you have the thorough history and physical, you should be able to do a complete assessment and write a thorough plan. Your plan definitely should include medical aspects of care and rehab aspects of care. So this all comes under plan of care. You should also address any ethical issues, any communication issues with the patient, with the family. This is also part of the patient care. The next thing is in terms of the core competencies. The next important one is practice-based learning. So as a physician or as a physiatrist, you should know in related to the diagnosis, is there anything else that you need to know for you to be able to do your job properly, to manage patient properly, and what resources that you need in terms of knowing like the plan of care or medical management, those kind of things. And the third important core competency is the medical knowledge. So the evaluations will also be based on your understanding of like anatomy, embryology, and also physiology, pathology, pharmacology, including pharmacological, non-pharmacological interventions, all those things. Medical knowledge is also one of the important core competencies. Fourth one is effective communication. You should be able to communicate effectively with the patient, with the family, and keeping in mind any of those cultural issues, any of those patient wishes. You should also try to address, are there any gaps in communication, any challenges in communication. You should be able to communicate with your team members, whoever is on the care team for the patient. That is the fourth core competency. Fifth one is professionalism. You should definitely exhibit high standards of professionalism in dealing with the patient, with the family, with your staff members, professionalism in documenting the notes appropriately on time. So that is in relation, and also trying to address anything that's coming in the way of those things, like a professional matters. That is number five, fifth core competency. Sixth one is systems based learning. So when you think about the patient, you have to think about the whole system, like where the patient is when you look at the whole continuum of care. So where the patient is going from here, and how are you going to address any challenges, any roadblocks in this continuum of care. What things might happen during this continuum of care, and what things you need to do in order to avoid any of those issues that might occur in the care continuum after the discharge. So that is related to the systems based learning. So these are the 6 main core competencies on which you will be evaluated every 3 to 6 months, and then also you will be evaluated based on your in-service examination. So it's important you keep in mind that you follow all these core competencies to be able to successfully graduate from your residency training program. So with this, I'm going to end this video. In the next video, we're going to talk about electronic medical records and proper documentation. Thank you. Have a good day.